Well, we work a lot with this concept of optimal defaults, that people are exposed to default conditions in their environment that affects what they eat. So if they're around large portion sizes, they're going to eat more. If they don't have access to healthy foods and they have lots of access to unhealthy foods, they're going to eat the unhealthy ones. If the school has crummy food that they're selling in the school, kids will eat it. If that food gets taken away, they'll have a better set of default conditions. So the idea is, what can you change in the environment so that healthy behavior becomes the easy behavior and the more likely one? And that's where we're trying to work. Well, certainly parents are influential in the home, but kids aren't in the home all the time. They're in schools, and so school officials have a lot to say about the food environment in schools. The kids are exposed to marketing messages from the food companies, so institutions such as the food industry are important players here. And then government has a role. Government helps determine how much certain foods cost, how much certain foods are available. They govern the marketing practices of the industry and basically let that go, and companies can do whatever they want. So institutions like government, schools can have a big impact. Well, one of the big blights on the food landscape, I think, is the marketing by the food industry, because we're overwhelmed by it. Especially children are overwhelmed by it. There's so much of it. It's so effective, and anything a community is likely to do in terms of a program can be undone by food industry marketing in a half a second. So I think marketing needs to be curtailed, and there's a role that the federal government can play, but also the state governments can be very influential here too, especially through the state attorneys general. But there are lots of other things that need to be tackled as well. We're working especially hard on the issue of sugar-sweetened beverages because these soft drinks, pop, whatever you like to call them, are having a big impact on health, and they really do stand out as a category of food that should be addressed through national policy. And so you can have educational campaigns to discourage people from consuming so much. You can promote an alternative like water, or you can get in and get policy involved, like the city of Boston and Cleveland don't let these beverages be sold on municipal properties. You have hospitals that are not allowing some of the sugared beverages to be sold. And so you have a lot of policies like this that I think are very effective. And then the other thing that we're working on in this regard is a tax on sugar-sweetened beverages. And there's so much good evidence from tobacco that a tax is a highly effective public health strategy that there's no reason to believe it wouldn't work in the food arena as well. Well, health professionals can be very influential because, first of all, they have a certain level of moral authority because they're working in the health arena and people will listen to them. But they can also be very influential by working through their professional associations, the American Dietetic Association, American Academy of Pediatrics, or whatever it is, to see that those organizations take strong stands on these food-related issues. But they can also be very influential as a political voice. They can call their legislators, they can work with the newspapers, they can do a lot of different things to let people know what's out there that's making healthy food more likely to be consumed or less likely to be consumed.